I'm Diane Ryan here in Scottsdale in the office of a doctor, and she says, yes, sometimes red wine, a glass of red wine once a day is very good for you, but for some others, it's not. And she's got a special test that'll tell you if you can or you can't. We'll have that story for you coming up.
Got to play the song when you're talking about wine.
Yeah, UB40. And you know, there are one of many groups that have recorded this song.
Yeah.
So red wine is very popular, not only to drink, but to sing about.
It sure is. Well, we have all heard for many years now how red wine is good for your heart, right? One Valley cardiologist says this is true if you have a gene to metabolize the wine.
Diane Ryan, right over here, is live now with the doctor to tell us about this test to determine if you have the red wine gene.
Yeah, that's right. We are talking about red wine and genes, and but not the kind that we're wearing. We are here in Scottsdale, and I'm here with the Dr. Feyrer-Melk, and she is with me this morning. And you say that this is good for some people to have a glass of red wine. It's medicinal for some people, but for others, it is not. And you have a test to show us that.
Right. Diane, as a cardiologist, I was having my glass of red wine every day for a decade, and then I had my genes checked and found out that I have the abnormal gene for the ApoE. It's called the ApoE3/4 gene that puts me at increased genetic risk when I consume alcohol.
So that was a surprise to you, or how did you find that out, and or even know about this test?
It's a simple salivary test. You do cheek swab and send it in. It can also be performed by blood.
So tell me a little bit about, this is kind of what your lab looks like, and what does it what did it tell you?
Sure. What the ApoE gene tells me, the first thing that puts fear in my heart, or the heart of any patient, is that I'm at a 42% increased risk of cardiovascular disease. I have some other genetic abnormalities here as well, but the ApoE gene also instructs me and my patients that alcohol is not medicinal for them, which is opposed to the American Heart Association recommendations that state that although they don't want patients to start drinking alcohol if they're not, if they are moderate drinkers, men can have 2 alcoholic beverages a day and women 1 for cardiovascular health.
So this kind of helps your patients, and it also probably made a change for you as well.
Absolutely. So the most important feature is to find things in our environment that can be helpful so that we don't have to rely on prescriptions and supplements to optimize our health.
And you were saying it's not just red wine, but it's also in beer and liquor as well.
I mean, everybody thinks that red wine is better than white wine, is better than other forms of alcohol, but really it's the ethanol that has the beneficial effects. So either 4 ounces of wine, a 12-ounce of beer, or an ounce of spirits can have the same cardiovascular benefits, which are significant. Most of the benefits of alcohol relate to its ability to increase your good cholesterol, called your HDL. Think H is for happy, you want that one high. The bad cholesterol, L is for lousy, you want that one low. So we want to optimize our HDL, and alcohol is wonderful in doing that. It can increase your HDL by 12% if you have 2 alcoholic beverages per day. So it is a medicinal benefit for most patients, but with the ApoE3/4 gene, about 25% of patients do not derive that benefit.
So how many people have you tested in the past?
I test every patient that walks in my practice.
And they've benefit from it?
Yeah, absolutely. It's a way to change your environment to fit your genes.
So not everybody should have a glass of red wine every day, right?
25% of us should not.
Okay.
You can have it in a celebratory sense, but it's not medicinal.
So now how much does it cost to have the test taken?
It's not covered by insurance, and there are different labs that do the test. So you would have to check what the price of the lab itself, but there's several in the Valley that perform the study.
But it sounds like it's pretty simple to do.
It's simple, and you only have to do it one time, and then you know.
Okay, well, thank you so much, Doctor. That must have been a big surprise for you, too.
Absolutely. I try to practice what I preach.
Okay, well, thank you so much. So maybe red wine is not so good for you all the time, but the test, I guess, would tell you one way or another.
Interesting. Okay.
Yeah.
Well, at least you could drink it to have fun.
Yeah, she said celebratory.
Celebratory,
okay.
right. All right.
You don't have to get rid of your Carlo Rossi yet.
No.